Today, we're standing together with men and women from throughout this country, many of whom are here from Maryland. And we're standing together because really, whether you're a patient, whether you're an employer, or whether you're a provider, you need a government on your side to make sure that we write a brand new prescription for what is ailing the American healthcare system.
We're told that if we don't do something at this moment, as much as 50% of the gross income of a family, an average family in this country, could be spent on healthcare costs very quickly. That is just unacceptable. And so we have no choice, in my view, but to reform the system, to step up and do the job that the American public are asking us to do, and that is to create accessible, affordable, quality health care.
We know that the health of our families, the survival of our businesses, and our long-term economic stability depends on us making sure that health care works for all Americans today, because today it just is not. Thanks to the President's directive and the tremendous work of the senators you see up here, Senator Dodd and Senator Kennedy, as well as the Finance Committee, we are working hard because we know we have an historic opportunity to make health care work and to take on the challenge of providing quality, affordable health care for everyone.
As Democrats here in the Congress, we're not interested in changing a system for the sake of changing it. If you like what you have, you get to keep it. We believe in choice. If you ought to be able to choose your doctor, choose your hospital, choose the kind of coverage you want to have. We're not interested in changing that which works. We're interested in reforming that which doesn't work, and a lot doesn't. And we spent a lot of time over the last number of months, in fact, going back a year or more, sitting with each other, the staffs working together to formulate the bill that we introduced last week.
I hope that we'll focus more on what brings us together than what pulls us apart. I think there's more in there. There's a center of gravity pulling us together rather than a few things that might tend to pull us apart.
There's a lot we can agree upon. I think that building on those common agreements, we can put together legislation that will be very good for the country. And I hope that we have serious buy-in by all of our colleagues in that effort.
Nothing would make me happier than to have us come out with a strong bipartisan bill. And I begin the process with that goal in mind. Not to achieve bipartisanship and a weak product, but to have a strong product that's endorsed by people across the political divide in the United States Senate. I still believe that's achievable. I still believe it's achievable. Our determination, again, is accessible, affordable, quality health care.
I want these young people behind us here who are entering the health professions, I want them to give as much time and attention and care to keeping people healthy as they will do getting people well after they've been sick. So we've got to change the sick care system to a true holistic health care system.
It's an economic issue. It's also a human rights issue, in my view. It's a question of providing that which people ought to have. This is not an optional commodity. This is not about what sort of a car you want to buy or whether or not you think you ought to have a TV or not. When an American gets sick and is in trouble, they ought to be able to have the comfort of knowing they can be helped. And they ought not to be determined by how well off you are.